This is my client Nancy, who is a chiropractor, and she was referred by a mutual friend, and she came and saw me for treatment at the Hesch Institute on Friday and Saturday, and she's very athletic. She came out to Vegas to run a marathon, and while she was here she thought it might be worthwhile to see me for treatment, so I thought I would just ask her to introduce her work and then just tell us her thoughts on the Hesch method. Thanks.
My work that we did here?
Your profession.
I'm a chiropractor, so I deal with musculoskeletal, spinal, and nervous system issues every day, and had sought out care with my colleagues to address the issues that I had with my hip and everything else that was affected as a result of that, or that was affecting the hip itself. So even with adjustments and physiotherapy and some acupuncture, my condition was unresolved. Prior to my treatment yesterday, I even went and got adjusted, but still had restrictions and symptoms that were not going away. So I sought out seeing Mr. Hesch based on recommendation of a colleague, and I think that it's been really remarkable to discover just all the interrelationships between my issues, my physical issues, and have noticed a difference already just in the way I stand, the way my gait feels, the less weightiness sensation of pulling down as that energy is draining and drawn inappropriately through my body. So I was lying on the table receiving my treatment, thinking about the patients that would benefit from a similar type of therapeutic approach, and have nothing but positive things to say about my experience. So.
And how would you describe the work? What is what we call the Hesch method?
Thorough, gentle, low force. There really wasn't any portion of it that was painful at all, and interactive in a way that I especially probably respond to. I think that being in the line of work that I am, it makes me even more curious and receptive to a lot of the information. But there really was nothing difficult about it besides just showing up, you know.
And what about the element of time for each treatment?
I think we accomplished a lot, and it didn't feel like it was a very long period of time at all, but the fact that I was here for 90 minutes of treatment seemed like it went by quickly, and but I feel like it was time really well spent, and the amount, like the amount of force that was used over the prolonged period of time was really effective, and all I had to do was just lay there.
So how long were some of these treatments?
5 minutes.
5 minutes. Yeah, that's
5 minutes. Yeah, five
yeah.
minutes for a low amplitude amount of pressure that made big differences in how I felt and how my body responded.
So there's a time to use a quick force and there's a time to use a slow force. So how do you comment on that?
I would say every body is different, and different things respond differently to, you know, different conditions will respond to different therapies based on that individual's needs. And for me, this is obviously what I was doing wasn't working, and so this is the first thing that I feel like has made the differences that I was looking for. And so, you know, the quick fix isn't always a quick fix if it's not fixing what needs fixing, right?
So my bias is that there's different approaches, and I think they all have a place.
Absolutely.
And I think oftentimes you can use both of them, that one approach treats certain facets of a person, and another approach may treat other things that aren't accessible by that.
Absolutely.
And you know, for that reason, I don't suggest that this replaces anything. I think of it more as additive to systems of treatment that are out there.
Absolutely.
That's kind of how I see it.
There were 187 different chiropractic techniques when I graduated from
gosh.
chiropractic college, and 5 of them are probably taught the most commonly, and maybe 20 are utilized out of all of them the most frequently. But the key is to, whichever one you're going to do be really good at and do really well, and don't try to do all of them.
Right,
and find, you know, it's just like any relationship, some things work great for some people and some for others, although there's a lot of what you do that utilizes chiropractic principles, and there's a lot of your, there are a lot of techniques that use that low lever of force, and so I love that what you're doing is utilizing what we do, just in a way that works better for some conditions like mine.
Neat. And so, having seen you twice, 2 days in a row, I'm giving you a short list of 8 things to do. Most of them you can do once a week.
Right. And for 5 minutes, so that's not time prohibitive whatsoever. And if it helps what you've done help me that much more consistently, then there's no reason not to do it.
Neat. And how do you feel overall? You made a comment when you got up and walked around today. You kind of had
a few... I felt lighter, yes. I didn't notice a pulling down sensation prior to my treatment, but I did notice a feeling of lightness, which, that sometimes after a chiropractic adjustment, if it's a really good one, I'll leave feeling that lift. But this was just a nice... I think when I exercise, I'll be able to notice that difference as well, that I feel lighter, want to run further, or, well, probably not.
And we found some real limits to what I could do, right? I mean, your right ankle is lax, your left knee is lax. Yes, we can do some strengthening and use the splint and such, but those ligaments are distinctly stretched, and
well, I did a good job of tearing them. So.
And I promise I can't tighten them up.
No, and without the blood supply, ligaments don't heal themselves.
They don't.
Those tendons do. So.
But fortunately, you've kept so strong that I think they'll do very well. So anyway, I want to thank you for your endorsement. I very much appreciate it.
Thank you. I enjoyed our time.